So, like the temporal, and then the zygomatic, buccal, mandibular, and then the subclavian, right? And the greater occipital is gonna be the back of their head, right? So then, when you go to the first and then the second, you can find the C2 from here, right? There's a one on each side. So it goes all the way up to, and then it branch out to innervate to the up to the top of their head. So it's really short, like from here, and then like branch off. So on this side, same thing, right? From here, and then all the way to the top, and then like this. And then lesser occipital nerve is included the new one, that one. So where you can come out, it's gonna be same thing. It's the second cervical nerve, and then it goes more to posterior side of the ear way, like this way, and it doesn't go to all the way up high here. So it's really short. Once you locate it, where is the second cervical nerve, and then go like this way, and that's it. On this side, so it's coming out like this. Okay? And the intercostal nerves. So if you know the level, they will tell you which level first, and then you need to calculate, like count down where it is, like a 7, for example, like, and then T1, 2, 3, 4, 5, and then you're gonna find the transverse, process it, and then the rib is gonna be go along, right? So then you need to trace the inferior border of the rib, and then trace along down all the way up to the front of the chest, like that, right? So when you get the any nerve rabbit cell is kind of gonna pass their breast tissue, then are you gonna just go whoop? No, you may fail because of that, right? So maybe you can ask your patient to cover their breast tissue, and then do I have consent to go over? So then you can kind of go over like that way, or at least you need to put something on the top, like thick towel or anything, and then get a consent, and then you can do it, right? So it's not the one that you can just swap. Yeah, even to the male, so the male and female, you need to get a consent from them. Okay? Long thoracic nerve is gonna be from the side. So where this nerve goes? To the serratus anterior, right? So it's gonna be starting from the C5 to 7, right? So you need to find C5 to 7 first root, and then it's gonna be go down all the way down. But you need to get a consent too, right? Because it's the it may cross the breast tissue, so you can ask your patient to cover their breast tissue and then moving away. And from the C5 to 7, and then tracing down, up, down. Just be careful that you are not going too further down because of the serratus anterior muscle is attached onto the rib 10 next, right? Some of it's 9 mostly, sometimes 10. So if you pass the rib area further down, then you are too far. Okay? Muscular. We were able to see the serratus anterior. Okay. And then the muscular cutaneous nerve. So it's gonna be same thing, C5 to C7, and then it pass through with the brachial plexus, which is passing the scalenes, right? And then it comes down from C5. So it passed the 3 muscles here, so coracobrachialis, and then the biceps, and then the brachialis. And after it passed the elbow, then it goes all the way down along the lateral part of the forearm, but it doesn't cross the wrist, right? So you need to stop here from C5 to 7. And move to the lateral part, and then to here. So this side. 3. And then just like going diagonal direction, and then go toward the lateral side of the forearm. And then ulnar nerve. So it's gonna be the same thing but the different route now. So C8 and T1, or sometimes C7 and T1, but most the book says C8 and T1 on the nerve root. And then it's gonna be past the brachial plexus from here, and then it's gonna pass along here. And there is neurovascular bundle with the ulnar nerve, median nerve, and then the brachial artery together wrapping around. So it goes same part of the area where it's the medial to the biceps, and when you reach to the halfway for the forearm, it kind of puncture through the septum, and then it goes to posterior side of the humerus. And then there's a notch for the ulnar, right? It have to pass that one, and then it goes along the ulnar side of the forearm, and then it passes the Guyon's tunnel in the hand, and goes to innervate to the fingers, and then there is a muscular branch goes all the way to the adductor pollicis too, right? So you need to trace all the way down from here. It goes puncture through, passing the groove, medial side, and then to the hand, and then the muscle, right? Check here. A2, and then sequence goes up and down, and then it puncture through the septum, and it goes posterior to the medial epicondyle of the humerus, and then like go along down, and Guyon's tunnel here, it goes to the finger, and then the muscular branch to the pollicis, right? And then the median nerve. So from the C5 to T1 now, and then it goes similar route to like the ulnar nerve, because it's shared the same canal now. And then for the median one, it's gonna be past, after it passed the elbow, and it passed the two head of the pronator teres, right? And then it goes more into the middle side of the forearm, and then it go underneath of the carpal tunnel here, right? Go through it, and then go to the thumb side of the finger, and then half here, and there's a muscular branch to the hyperthenar muscles, and then there is a one branch that coming off out from the rectus flexor retinaculum, and then skin for this subdive too. And there's another branch called anterior interosseous nerve, is coming off from the after it passed the pronator teres, and then it's just deeper than the actual median nerve. It's just innervated to the deeper side of the muscle, like the flexor profundus, distrum profundus, yeah, something like that. So there is a lot of branch here. So let me do it again. So 5, and then T1, passing between anterior and middle, middle to the biceps, and when you pass the pronator teres, and it's kind of branch out all the way to passing here to the fingers, muscular branch, there's another one here, and then there is an anterior interosseous nerve up from. No, sorry, pronator teres, pronator teres, right? And then the axillary nerve, right? So axillary nerve, it's gonna be a little bit tricky because it's starting from here, but we cannot really trace it well because of the clavicle and then the scapula here. It goes like between here. So 5, 6, and then it goes between here, and it kind of puncture through the triangular space at the posterior side, and it goes to the deltoid and then the pronator teres like this. So the tracing it's a little bit tricky because we cannot go past through here from the 5, 6, and then it's coming off from the quadrangular space and goes to the deltoid and then the teres minor. And the radial is so C5 to T1. It's gonna be easier for you to start from the posterior part of body, like unless other things is going more anterior body, right? So from here, after you pass the anterior and then the middle scalene, and then you cannot really trace it like through here. That's why I'm just going over the posterior part of it, because it's coming off from the triangular interval we talked about from the triceps to head, and then there is a spiral groove on the posterior side of the humerus that is go along there, and when it pass the elbow, and then there is a different branches. There's a superficial branches goes all the way down to the web space between the thumb and index finger for the sensory, and then there is a deep branches for the whole extensor of the muscle and goes all the way down to innervator here, right? So you need to trace it from all the way from the top. Just going to the posterior just because it's easier to come off from the triangular interval here, and then spiral groove. There's a superficial branch, and then the deep branch all the way to. Do you want to show you one more time? C5 to T1. middle branch. Branch. Not the tip. So tomato. I already told you that it's just wrapping around their arm. So when you have your patient arm like this,